Our massage stroke for today is friction. Friction is a massage stroke that the movement is from superficial tissue towards over the deeper tissue. Friction consists of circular movement friction, cross fiber friction, longitudinal friction, static friction, and multi-directional friction. I'm gonna use as example the rhomboid muscle. So the rhomboid muscle, its origin is from T1 to T5, and the insertion is across in the medial of the scapula. So the fiber of the rhomboid is like transverse, this way, crossing from medial to lateral fiber. First, we're gonna do the circular movement friction. The friction is a kind of technique that the movement of our hand not glide over the skin. It rather just penetrates depthwise into the layer of tissue by breaking down adhesion and scar tissue. Our hand do not glide on the skin. The muscle is the one we move circular movement. Then, circular movement into the rhomboid. As the rhomboid fiber is from medial to lateral, then the transverse is against the muscle fiber. We don't slide our hand to the skin. Instead, we move the muscle into the depth layer. Intention is to break down adhesion and scar tissue. But if you do longitudinal friction, the movement is following the fiber of the muscle. That is a longitudinal friction. And the static friction is a steady friction. This is the rhomboid. We're gonna do from light pressure and little by little going deeper in our tissue. And static is only steady. We don't move, it's just steady and little by little getting deep. Friction is therefore used by the massage therapy for some deep tissue massage. Friction is also helping to release of trigger point and spasm into the muscle. So the friction is just steady. It don't move. It rather penetrates to the superficial tissue up to the deeper tissue. Steady, and when we release it, it's better if we release it slowly. We can do the friction in our whole body. The last one is multi-directional friction. The multi-directional friction is a friction that we can use circular movement, cross fiber friction, longitudinal friction, static friction, go back to circular movement, cross fiber. So all the frictions that we have, we can do it in multi-directional friction. We can use our thumb to our static friction. We can use our elbow or our arm to do the multi-directional friction. We just need to make sure never slide our movement into the muscle. Therefore, the multi-directional friction is ischemic compression. And the static friction is just steady. And the circular movement friction is circular pattern. And the cross fiber friction is perpendicular movement to the muscle. And the longitudinal friction is a movement that following the fiber of the muscle. This is static friction using our palm. Static friction using our thumb. Static friction using our thumb in the lower back. Static friction using our forearm in the lower back. Circular friction using all our finger in the lower back. Remember, we don't slide our movement on the skin. The muscle is the one who moves. Circular friction. And we can do also knuckle transverse friction, knuckle longitudinal friction, and all finger multi-directional friction in the lower back. Static friction on the gluteal region using our elbow. Static friction using our thumb in the around the trochanter. Longitudinal around the trochanter, transverse around the trochanter, circular friction around the trochanter. Please subscribe to my channel.